Hi, I'm Kevin Cummings. At Investors Bank, we believe in helping our local neighborhoods and improving the lives of all we serve. We're a different bank that makes a difference for our employees, clients, and communities. That's why we're proud to support public television and the programming produced by the Caucus Educational Corporation.
Funding for this edition of One-on-One with Steve Adubato has been provided by the Healthcare Foundation of New Jersey, founded by the Jewish community, Barnabas Health, Life is Better Healthy, PSE&G, committed to improving New Jersey's economy and strengthening its communities, Health Republic Insurance of New Jersey, Choose New Jersey, our mission is attracting companies to the Garden State, NJ Best, New Jersey's 529 College Savings Plan, turn a dream into a degree, and by QualCare Inc., a local managed care company covering 750,000 New Jersey residents.
This is One-on-One.
When you first heard that they were doing Charlie Rose and Gayle King, didn't you go, what?
People like laughing at others, so I don't mind if the other is me.
See, you go right into the character. That's what it is.
I'm bringing families together a half an hour each week. Man, I'm doing something special.
And so I do feel successful.
Hi, I'm Steve Adubato here at the campus of the New Jersey Institute of Technology. We just finished up a very dynamic and informative forum on the ACA, the Affordable Care Act. We're doing this a few days before March 31st, the final days of the first enrollment, right? People are supposed to sign up for the exchanges. And so we had some experts. We had a panel of folks who were talking about that. We had some consumers, students, and others who wanted to really get information about the ACA, how it works, some of the challenges that have taken place. And so it was a great conversation back and forth. We're calling this a last call. It's the last call for 2014, but we also talked about what happens for 2015. It's a great half hour of public television about the most important issue of our time, healthcare. It's never going to be the same. 74,000 of approximately 350,000 people who are eligible. That's less than a quarter. So we want to be positive, we want to be upbeat. We're not like those folks out there who say, this doesn't work, it's no good. We want to be a part of the solution. But we also want to understand what have been the challenges that we have faced and the lessons learned. Wendy, biggest challenge number one, biggest lesson learned, go.
The biggest challenge has been when we're talking to individuals, getting them to ask the questions that they're wondering about. Once we have an open forum, I think it takes maybe one or two questions from an individual before we start to get down to the nitty-gritty of why individuals feel like they either can wait to get some type of health insurance or they didn't want to ask the question. When I'm talking to consumers, the questions are, I'm homeless, do I still need to get health care? I'm unemployed, do I still need to get health care? I'm an ex-offender, do I still need to get health care? Or I'm not a citizen, do I still need to get health care? And so these are the types of questions that we like to get out into the open, because what the individuals do is they take it back home, they mull it over, they decide if if this is something that they want to go ahead and do, or will they just take the penalty and see how that turns out?
So let me just take the penalty and so no big deal, you say?
Well, these are some of the, especially from our challenging consumers, which are our younger groups from 18 to 35. We're really trying to get them to understand that this health insurance is something that they should have. I mean, they think they're invincible. So, get that information out, let them know, and then what they do is they take it home and they tell other people. So just kind of get the word out, word of mouth. They like face-to-face attention. Advertisement works, advertisement is great, but I think the greatest assistance is face-to-face assistance. When you're talking to someone and you can look at them and say, okay, I trust this person, and I'm going to listen to what they say, and I'm going to take this information back to my family and let them know the information.
But it's so interesting, you say face-to-face, but you have to get them in the door to get FaceTime, right? So how do you do that? Jump in. By the way, use the microphone down there. Just get it ready. No, you don't have. You can share it here.
No, that's a good one, because for NCHC, which is a community health center,
Community Health Centers.
Your community health centers. We understand that the main problem is communication and education. And so what do? First and foremost, we make sure that we hire people who speak the language. You must remember that a lot of people in our community are have different ethnic backgrounds. A lot speak Spanish, we have Haitian people, we have people who speak Portuguese, we have every language you can think of. And people want to be communicated to in the language that they speak. So we actually hire people who speak multiple languages and we send them into the community, and they also must look like them. So that's a starter.
Why does that matter?
Because
they can't look like me?
Well, yes. We have people look like you too.
Okay, I just want to. So what? No, in all seriousness, why does it matter that you're talking about people of color, people of certain communities? Why is it important that they are the ones meeting the ones who need insurance the most? Why is that so important?
Trust. Trust.
Talk about that.
Trust.
You're applauding for trust? I just want to clarify.
If you don't look like me, talk like me, sound like me, then they're not listening. They're not hearing and they're not listening. So you have to meet that mark. And once you meet that mark, then people will understand. And then most important, you pull out that computer because we're trying to enroll people using technology.
Technology is a barrier?
It is a barrier.
How so?
Because even though everybody's texting and using all of the cell phones, try to get somebody to go online and put in their social security number, put in their address. It's a problem.
Why?
It's a problem. Because there is no trust. And then you're seeing an internet where you're putting my information out there. Woo.
More, I see you shaking your head.
Well, both Wendy and Dr. Clark brought up some really good points. Wendy spoke about people considering whether or not they should get health insurance. What we see is many of those populations that she mentioned don't know that they can get health insurance. These are people that historically have been left out of the system. This Affordable Care Act covers people of all income levels. It covers immigrants. It covers those with criminal records. It covers a lot of people. And here in New Jersey, the total is 900,000 of our residents are newly eligible for coverage. 88% of them are eligible for either free or low-cost health insurance with premium tax credits. That's a message that's very hard to get out to millions of our residents in one of the most diverse states in the nation.
Let's talk about that a little bit. Getting the message out. We can do what we can do in public television, right? Our friends on public radio can do what they can do. But to what extent is it the job of the media, and which media are we talking about, getting to the communities that you are talking about, right? You're talking about commercial media in addition to public broadcasting. And to what degree are the radio stations, television stations, and those who have direct access, right, mass media, jumping in saying, we're all in, we want to be part of this, we're giving you public service announcements, we want to get to those communities. Do you see it? Do you see it?
We don't see it. No, we don't see it. And one of the things we would have liked to have seen is New Jersey had the opportunity to use $7.6 million in federal funds to promote the marketplace. And that didn't happen because Governor Christie sent the money back. So those kinds of things have damaged our ability to get the word out. And what we would like to see is not only media, but if every state agency who had a connection to a consumer had information on the Affordable Care Act. Every point of contact matters because it really is one-to-one, hand-to-hand, face-to-face.
Respectfully, your phrasing and your framing of Governor Christie sent the money back has to be clarified. If the governor were here, and he clearly is not, he would say he didn't simply send the money back. He would argue that he does not believe in the act. He also argues that the federal government should be the entity that manages it, administers it. So we opted out of the effort to run it on the state level. So therefore, we are not going to take that money because there are too many strings, there are too many questions, and therefore it's not appropriate for us to take the $7.6 million. That's what he would probably say. And I don't want to debate it on his behalf, but he wouldn't just simply say, hey, take the $7.6 million back. Fair?
Fair.
And
but
you say?
I say, he says He's not for the Affordable Care Act, but Governor Christie did do something very good for the people of this state.
Talk Medicaid.
Talk Medicaid, that's right. And Medicaid is a cornerstone principle of the Affordable Care Act. You can't have it both ways.
Explain that to folks who may not understand the public policy implicated. Well, forget about public policy, the tangible impact of the Medicaid expansion.
Medicaid formerly was restricted to those who were on general assistance and people at a very, very low income limit. The Affordable Care Act took that and expanded Medicaid so that individuals who are working can still qualify for Medicaid. They can be part of the New Jersey Family Care Program with incomes up to $15,800. That's for an individual. This captures a lot of our low-wage workers, people who historically have no option for health insurance. So that's a great thing that was done here in New Jersey. Many states opted not to do it. So having taken that, the piece that's missing is the other 600,000 people who are eligible for coverage are eligible for the marketplace coverage. And it benefits us all, our economy, the insurers, our health system as a whole, to get those people insured.
Tanvi, I want you, if you could do this, and I'll come back to you, Dr. Clark. There are 4 levels, and help me on this. There are 4 levels that we're talking about. If I get this wrong, I know you'll correct me. There's, in terms of the marketplace exchange, the exchange, if you will, the ACA. There's a platinum plan, there's a gold plan, there's a silver plan, and there's a bronze plan.
Correct.
Right? Let's break this down in simple terms. The platinum plan is the highest premium. It covers an estimated 90% of your health care. How do I get that plan? It sounds like a good plan. How do I qualify for it?
So in order to qualify for that plan, you need to either have an income level that allows you to qualify for that plan.
What would that be? How do we see?
Help me out.
In order to get that great plan, look at it. Do I qualify for the platinum plan? 90% of my health care expenses would be covered. 10% out of pocket. Who would want that plan by a show of hands? Who wants the 90% plan? Not a bad plan. How do you get it?
So with the different tiers, what you can do is once you go through the marketplace and you determine eligible to receive health care through the marketplace, you're met with a lot of different options to choose from in terms of health care and health insurance companies. And then, so within those health insurance companies are the different tiers. You have the option based on what you can afford, what coverage it offers, who the doctors are, you know, what you're looking for personally in terms of health care. You have the option of picking one of those tiers. But remember, when you pick a tier, you're going to have a premium that's attached to it. And the platinum premium, as we were talking about, is one of the more higher premiums. If you can afford it, you can pick it. But just remember that that's what you're going to be paying, whatever it is, per month. And so there are other tiers, such as the bronze and the silver, and then with the household incomes, you may qualify for what's called a tax credit or a cost share reduction, which is a discount that could be applied to your monthly premium or your co-insurances or your deductibles.
Let's go through this. The gold plan, it's an 80-20 split, right? 20% out of pocket, right?
Right.
80% covered. Silver plan, 70-30 split, 30% out of pocket, 70% covered. And the bronze plan, a 60-40 split. And basically you're saying it's what I choose. Is that fair, Dr. Clark? If I want to pay the premium, I can get a better plan?
Based upon their income and what they can afford, they can choose one of the 4 levels. Now, the majority of the people are choosing the bronze plan because, as you know, the people in our community,
That's a 60-40 split.
Yes. A lot of people work, but they still don't earn enough that they think that they should choose the platinum plan, so they tend to take the basic plan. No, the reality is this, and I said it before, is that even though they're choosing the basic plan, there is a fee. You have to pay the premium, and there are people who are getting their cards and thinking they have insurance, and they have not even paid the premium.
Young lady right here, just tell us who you are.
Hi, my name is Neeraja. I just wanted to know, how can I make an appointment? And if I miss the deadline for making the appointment, by the deadline, will I be subjected to a fine still?
Well, let me do this. One of the things about tonight that's so great is we actually have people here, right there, with laptops, prepared to do what needs to be done to get you enrolled. We're here with Tara Daniel, who is one of the, should I call you a navigator? Because I know you have certain credentials that help people through this.
I'm actually a certified application counselor.
Okay. You help folks actually go through this. There were folks after the forum here at NJIT on the Affordable Care Act, the exchange, a couple of days before March 31st. You actually helped people who came back there and asked questions. What kind of questions were they asking?
You know, they were asking, was this program right for them? Could they get health insurance? The woman I helped tonight enroll in New Jersey Family Care, or at least submit an application for New Jersey Family Care, had actually been rejected previously before Obamacare came into effect. So for her, she didn't realize that a year later, she's now eligible where she wasn't before.
What's that like for you as a professional, as someone who tries to help people, to see them come here saying, oh, I don't know what to do, and then you actually help them do that?
It's really exciting, that moment where you say, actually, this is for you, and this will help. When people have questions and concerns and confusion, and the answer is actually yes, rather than a no. It's really exciting.
And for those watching us right now on public television who say, well, I don't have someone helping me through that. I feel all alone. I don't know where to go. I don't know what to do. You say?
You know, there are more than 100 different places in Newark offering some sort of assistance right now.
And in cities across the state.
Exactly. When you go on healthcare.gov to connect with that in-person assistance, that there are people throughout the city, and will be every night this week, every day this week, there to help you.
And after March 31st, which this interview will be seen after March 31st, what do you say to folks who say, all right, I didn't do it this time, I got to get ready for next time, which begins on November the 15th, and the Medicaid enrollment continues, right? So what do you say to those folks?
You know, learn about this program. You could be eligible for Medicaid, so you might still want to come talk to someone in person, and you might want to find out what you need to know in November, figuring out what your tax household is, figuring out if maybe you're having one of those qualifying life events, like a birth or a move that's going to enable you to actually enroll before November.
We're here with Zenaida Lopez, who is a certified counselor who helped people tonight. Zenaida, talk about the experience of actually helping people make sense of all this.
Okay, it's really hard because a lot of people think that they have to, some people have insurance and they're like, oh, I have to get another insurance. Oh, I'm going crazy. Or I heard it's going to be $400. I heard it's going to be $1,000. I heard if not, I'll just pay the penalty. They don't know what to do. They're stressing out. And now for our agency, they're waking up, and a lot of them want the help, but it's just that we have limited time and we have limited staff. We're even getting another agency to help us out, to help them out. And is also the marketplace as well. The marketplace freezes too much, or we can't verify their identity, or they left a document, or they don't, or they're missing something. Something's always wrong.
It's interesting, again, just a few days before March 31st, we're doing this. You do what you can before March 31st, but what do you say to those who are watching this after March 31st?
To get prepared for the penalty, because, I mean, we wish that the government would extend it. That's all we want.
Let's assume they're not going to.
If they don't, then those people would, unfortunately, would have to pay the penalty, but they won't see it until 2015, and people are not aware. People are like, okay, so 2014 we won't see it, but when it hit, and then it hits them in 2015 when they do their taxes. That's where it's going to come out.
And then the enrollment starts for 2015 on November 15th, 2014, and you do, what should people be doing then to get ready?
Make sure they have all their stuff, their documents, trying to get educated, know what they need to do, know how the marketplace works, period, and get educated.
Explain to folks, when it comes to behavioral health issues, mental health issues, with the Affordable Care Act, what has it done for folks as it relates to mental health issues? Is it a good thing? And for those who need those services, shouldn't they be jumping to sign up?
Yes, two things. A lot of people don't know that mental health is covered by Medicaid. So there's that public service piece of getting the word out. I think the second thing is that people who are aware of that jump on it, particularly in the community. But the rates are different. The rates are much lower for adults, which really boxes them out of getting access to mental health care in comparison to children.
Oh, explain that again.
I certainly will. There's two different rates. To assist a child with mental health care, it's a competitive rate. It's about $86 a session, which makes it much more competitive. But for adults, is, I think, $24 a session. And most practitioners in private practice just won't touch that. So you have a couple obstacles. You're eligible for Medicaid mental health assistance, but you're dealing with a competitive number, and that makes it more difficult. What we're seeing is an increase in both adults and children, because we're backed by several foundations, including the Healthcare Foundation, which makes it easier. We also have the advantage of being able to provide services in several languages. So it's a win-win, that they could come in, have their Medicaid accepted, have assistance being provided with different languages. And we're seeing people, obviously, with invisible issues, depression, anxiety, things you can't see. So we're doing better, and there's always the rush to provide a need that continues to escalate.
Courtney came here tonight wanting to get some questions answered. And my understanding is you actually work with some of the folks who are navigating through the website and actually enrolled.
Absolutely. Very excited.
Talk about that.
I actually went to North Healthcare. There was like, go to NJIT, and I was like, okay, I came here. I was more than happy I did. I got tons of information that I can go home and share with my family now. And I signed up, and I'm excited to receive something back in the mail and just, to take the first step in really communicating, because this is really important, and a lot of people really don't have insurance and think it's like nothing. And I realize how important it is the older I get. So.
What do you say to all those who say, oh, it's so complicated, I can't navigate it, and no big deal, I'll wait till next time, you say?
I say it's important, and not next time, today. Tomorrow's not promised, today is. You know what I mean?
This was worth it for you tonight.
Absolutely. Thank you.
By the way, describe the process the process you went through. Describe what that was like.
It was easy. I think it would have took 10 minutes if I wasn't asking so many questions, but I wanted to be informed on what I was putting in the computer. But it was very easy. You put your information in, you get your address done, and it's very simple and easy for me.
After March 31st, if you have a special circumstance, like you lose your job, you move, you have a birth or a death in the family, you will be able to apply for health insurance. The marketplace will remain open to people who have a special circumstance, a change in their life that makes them now eligible to apply for the marketplace. So if 2 months from now you switch jobs, you can apply at the marketplace. And what I would tell you is it doesn't cost anything to shop.
Even though the official deadline, in fact, is the 31st of March, this program will be seen after, we're making it clear to folks that there are special circumstances. We're laying out what those special circumstances are. We're making it clear that if you think you fall under the category of one of those special circumstances, you really need to reach out and try to apply and try to enroll under the ACA onto the exchange. Because again, you have nothing to lose. And if you wait until November 15th of 2014, there's no reason to do that. Do it now. You walk away tonight with what kind of valuable information?
There's a lot of valuable information.
Well, one piece that you take away saying, hey, I'm glad I know this now.
All this information is out there. It just needs, and you have to go out there and find out what you're able to get. It's out there. It's available. You just have to go out there and find out.
Yeah, no one's going to knock on your dorm room and say, hey, listen, we got some great information for you. You got to go out there and get it, right?
Yes, sir. You have to get it, or else, there's different ways to get the media or the information, but you have to find out some of the specific ways. The way I found out is through the internet and the media, because I watch TV.
Steve Adubato here with Lisa Block from the Healthcare Foundation of New Jersey. Just finished a very interactive and interesting forum dealing with enrolling people in the ACA, doing it a few days before, as I said, March 31st, the first official enrollment period. But you tell folks again what you were saying about the Medicaid enrollment continuing. It's really important.
Yeah, so the marketplace ends, the enrollment period ends on March 31st, but that is not the case for Medicaid, New Jersey Family Care. That date, every day is a day that a person can enroll. And here in Newark, where we are supporting and encouraging people to get health insurance, in fact, most of the people who are signing up through the different organizations in the community do qualify for Medicaid, New Jersey Family Care. So really, that is a very important opportunity here in this community.
And what's so interesting is right behind Lisa and I, there are actually experts navigators, if you will, who are helping people. You get a shot of the Sandra, if you could. They're actually helping people go through the computer, going through healthcare.gov. Why is that so important, Lisa, the hands-on help?
It's so confusing. It is just so confusing to understand. I mean, people are smart. Everybody is smart. And then you sit down and try to understand what your options are. What do I have to pay? What does it cover? And you really need somebody, an expert, to work with you and go through the process. You know, you can do it on your own, and certainly anybody is welcome to do that. But I think that it can really give a person a sense of comfort and can help complete the process and to have somebody they trust to work with them.
And finally, for folks who may be wondering, why is the Healthcare Foundation of New Jersey even involved in this ongoing effort? You've been doing this for a while. Why?
This organization is a nonprofit foundation, a private foundation that was created when Newark Beth Israel was sold and to another hospital system, and those assets were retained to help the community. And so since that time in the 90s, we are here to support the health of people in this community and make Newark and the surrounding areas a better and healthier place. And I believe that we're here to serve, and this is a very important time in our history when many people in this area who did not have insurance can now have the opportunity to be healthier in their lives and do things differently. And so we firmly stand behind that, and we're very proud to be a part of it.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the Healthcare Foundation of New Jersey, Barnabas Health, PSE&G, Health Republic Insurance of New Jersey, Choose New Jersey, NJ Best, New Jersey's 529 College Savings Plan, and by QualCare Inc. Promotional support provided by The Star Ledger, powering NJ.com, and by Commerce Magazine. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System. This program has been made possible in part by New Jersey Sharing Network.
Hi, I'm Peter Rooney. In 2006, I lost my father to renal disease. He was on the waiting list for a new kidney, but did not receive one in time. Unfortunately, so many like my father have lost their lives while waiting for a life-saving organ. At New Jersey Sharing Network, we're committed to saving and enhancing people's lives through organ and tissue donation and by informing people about this important decision. Because you can make a difference and save a life.